My name is Shahbaz Malik. I did my internal medicine residency in Fargo, North Dakota, and then I came to Omaha for my cardiovascular disease fellowship. I did 3 years of training in that, and then I opted for an additional year of interventional cardiology and structural heart disease training here at UNMC as well. I was always one of those kids, way back when I was little, that wanted to do medicine. I wanted to become a doctor. There were other kids in my class that wanted to be astronauts or firemen, and this was just kind of my calling maybe from the get-go. Specifically then in medicine, once I started to pursue that, I was just fascinated by cardiology, specifically because for the very simple reason that the heart was the most mobile structure in the body. It constantly was moving, valves were opening, closing, the muscles were tightening, ringing, and it was really fascinating to see how everything else kind of just stood still, doing a lot in the background, but the heart was constantly in motion. In cardiology, then there's multiple different subspecialties that one could pursue, and then the one that really spoke to me and was near and dear to my heart, no pun intended, was interventional cardiology and structural heart disease. Interventional cardiology, a lot of those that do actually pursue it like it for probably the same reason that I do, that you're able to immediately make an impact in an individual's life. And patients that come to see us acutely oftentimes are rather ill, and we're immediately able to help them out. And not only is it great for the patient, but personally it's very gratifying. From a structural heart disease standpoint, what I really love about it is the collaboration, the collegiality between our surgical colleagues, our imaging colleagues, and then us as interventionalists, all being able to kind of sit down, work through a patient's case together and be able to make a determination on what the right course of action is. And then while we're actually performing the procedures, to be able to have everyone in the room. UNMC Nebraska Medicine appealed to me for I guess a couple of different reasons. From an organizational standpoint, it's great to be part of a group where an emphasis is placed on acquiring the right kind of equipment, the right kind of resources, and the right kind of staff to go along with all of that to be able to provide exceptional care. And Nebraska Medicine, UNMC, definitely does that. Academic medicine is something that was always very important to me, because I wanted to make sure that I was able to give back to some extent all of which that I had received. I'm here today because I've benefited from multiple different mentors, faculty members, friends, teachers that have all kind of shaped and guided me over the years to allow me to arrive at this point. And I feel that it's incumbent upon me to be able to kind of do the same for the next generation of physicians that are coming up, and academic medicine allows you that opportunity.